The only way to diagnose suspected prostate cancer is to perform a prostate biopsy. But the heterogeneity and multifocality of prostate cancer makes its diagnosis challenging. Tumors can't be visualized, and some may not be detected by MRI. And because a systematic biopsy samples less than 1% of the gland, a tumor can be missed up to 30% of the time. While advancements in MRI and image-guided biopsies have improved detection rates, the vast majority of the gland is not sampled, and tumors may be missed. Considering the patient's risk factors, biomarker test results, and imaging that guided the decision to undergo the prostate biopsy, a negative result leaves questions unanswered. What if the patient is harboring clinically significant prostate cancer in the 99% of the gland not sampled? What if the patient is non-compliant with follow-up and therefore can't be monitored? Despite the risk for clinically significant prostate cancer that remains, the patient must heal from the trauma of the biopsy and wait months before any additional testing can be performed. This is the ideal time to order Confirm MDX. Confirm MDX tests the residual tissue from the patient's prostate biopsy to assess the methylation intensity of tumor suppressor genes, which doesn't require the patient to endure additional invasive testing. Helping to address the inter-observer variability that exists with imagery and pathology, Confirm MDX is a precise, reproducible diagnostic test which works by detecting DNA methylation. As methylation intensity increases, the genes are not able to suppress tumors as they should. Because methylation occurs early in the oncogenic process, Confirm MDX is ideal for the early detection of epigenetic changes which cannot be seen with imaging or a microscope. This precision diagnostic test provides critical insight to the patient's prostate biopsy tissue that cannot be revealed by any other test available, allowing the provider to make the best recommendation for patient follow-up. Armed with the Confirm MDX result, the urologist can focus on patients more likely to be harboring clinically significant prostate cancer, allowing time and resources to be directed where they are needed most. In fact, Confirm MDX may avoid up to 60% of potentially unnecessary repeat biopsies as compared to the current standard of care. As the only tissue-based post-negative biopsy test available, Confirm MDX should be considered at every cancer-negative prostate biopsy to rule out undetected clinically significant prostate cancer and determine follow-up patient care. Included in the NCCN guidelines and covered by Medicare, as well as most private insurers, Confirm MDX is affordable for patients. To check out our latest Confirm MDX case studies and learn more about how the test helps identify patients at risk for aggressive prostate cancer, visit mdxhealth.com.